Good evening, folks. Good. We are live. All right, tonight we're going to talk about the neck a little bit more. The actual title is where is this neck pain coming from? We're going to go over a lot of different possibilities. Not certain if your actual neck pain is coming from there, but it's a good possibility if it's something that is mechanical in nature, which means it can be pain-wise can be increased, it can be reduced. We're just trying to figure out where exactly that pain's coming from, and that's what we're going to talk about tonight. We might go over some treatments if you guys want to go over that a little bit. If you guys want to talk amongst yourselves and try and see if you guys want to go ahead and subscribe to one another. Obviously, we want to stay away from spamming because I want to make sure that this video actually can go up and I wouldn't have to delete it because of spam content. So let's go ahead and we're going to go over the spine just real quick, just the basic anatomy of it. If you have any questions, just kind of throw them out there. It looks like I have a few in the chat right now. I have X-Ray Lady, Riz Daly, and Pennsylvania Trapping. Oh man, Pennsylvania Trapping coming in. All right. So let's go ahead. I'm going to kind of show you on Mini-Me a little bit, and then I can go ahead and show you on Big Bertha here if you want, so we can go over that. But this one's a little bit lighter. All right, but the reality is this. So you have the base of the skull, and then you have 7 vertebrae or 7 bones that actually make up your neck. And then that little bump in the back that everybody can feel, that's actually C7. All right, that's your 7th vertebrae. And that's where about 50% of your movement looking down and looking up comes from, is from that one segment. The rest of the segments make up the other 50% of your movement. So if you're having an issue down low in your neck, so you realize at that point, you're going to be restricted at least 50% of looking up and looking down. Looking left and looking right. Hi, Cubs Den. Thanks for coming. Go ahead if you guys want to talk amongst yourselves. But that rotation up there at about C1 and C2 is basically at the base of the skull. And about 50% of your movement looking left and looking right comes from there. And the other vertebrae make up the other 50%. So a lot of your movement looking up, looking down, and looking left and right come from 2 segments, one above and one below. And then everything in between there makes up the other 50%. So if you're having problems at the top or having problems at the bottom of the neck, you realize that you're going to have a 50% loss in motion for whatever reason, whether you've got an arthritic joint or whether you've got maybe some muscle spasms going on in there, or something crazy like a fracture or a surgical site. Maybe you had to have a surgical fusion, which means is that they fuse some of the bones in the spine. So they take out the disc, which is those things between the bones that kind of cushion everything. And then they kind of put the 2 ends together and actually put screws in there, maybe a plate to hold that segment in place if you fractured it. Right now, it looks like I have 1 in here from what I can tell. Give me a shout out if there's anybody else in here besides myself right now. All right. Cubs still here. Well, thank you, Cubs Den. That's very sweet of you. I did get your live stream early this morning. I got a bunch of it, didn't get all of it just because I had to go to work. Like you always say, you can rewind it and watch it later. I'll probably end up doing that. If you have any specific questions on your neck or something else, I'd love to give you some answers to it. Oh, okay. We got more people here. All right, so I'm gonna leave this down here so I can see if you guys have any questions about that. So as you guys are flying through. All right, and so let's just talk specifically for a second, just about your neck in general. Now there's muscles, there's three basic layers to your muscles. You have the deep, deep ones that are attached right to the spine. They help rotate your spine. They help kind of tilt your spine sideways. And then you have some muscles above that are more superficial or closer to the skin. All right, and those are larger muscles, and they help really do a lot of the movement and power. And then you see these muscles that I'm doing now are called our shrugging muscles. Those are the ones that we can kind of touch all the time. A lot of times when you're having like headaches, excuse me, which sometimes are called suboccipital headaches, those are the muscles that run at the base of the skull and attach to the first little bone. Those are our nodding muscles. And a lot of times they can get really painful. Let's say a whiplash, or if you've been put on stretch or you slept wrong, or maybe you fell asleep on the couch or something and your neck was out pulled for a while. Those can actually give you some headaches. And the best thing you can do for that is just rest it and ice it along the base, maybe 15 to 20 minutes. And then hopefully in a day or so, you'll recover from that. And hopefully you will stop doing that. But they can give you headaches that come across the front. They're bad enough they can make you lightheaded or feel like you're dizzy. There's vertigo that you can have. If your neck is bad enough, you can get like the room is spinning. And if you have neck muscles that are really painful, they can give you some symptoms of vertigo, which is it feels like the room is spinning. All right, X-ray lady. Now I know. Now I understand what was said the other day. Okay. What is really whiplash? Okay. So that's a good question, Cubden. So really what whiplash is the actual muscle tissue itself is actually torn. You actually get what are called micro tears within the muscle fiber and the tissue. And so you actually have a little bit of bleeding that happens, and it's usually at those base of the skull muscles and those muscles that actually slow down rotation this way. Now you're going to have these, what we call these larger global muscles, like these big muscles we can touch, as well as your upper traps, because they've actually, in a car crash, it's not only the car that's moving at a certain speed, your body and everything else is also moving at a certain speed. And it all has to decelerate very fast. And so all those muscles are going to go ahead and tighten up to kind of support your entire body as that happens. And so you can get some tears in the tissue and also what we call the myofascia. And that myofascia basically is the tissue that lines the muscle. And you have what we call the myofascial system throughout our entire body. And there's gurus like John Barnes that works on myofascial techniques. And that's what that's his kind of claim to fame in the physical therapy world. I call him the Santa Claus, because if you type in John Barnes, he's not promoting me at all. Trust me, I'm not getting a dime from John Barnes. He looks like Santa Claus a little bit, and he sells courses and weekends and stuff like that for physical therapists to go to and learn his specific techniques. Yeah, hi, Scully. Oh, Scully says hello to you too. Now, the last time Scully was upset because I took his head off, and I was looking inside to see if there's anything in his head. He got upset, and so he hasn't been talking to me the last few days. He's been really, if mum's the word, he's been really mumming it out here a little bit. So maybe at some point we might do an upgrade to Scully and see if he can kind of talk to us a little bit more. So we're going to leave Scully right here because he's kind of in timeout. And so, yes, so that tissue initially needs to shorten from being stretched. So the last thing you want to do when you're getting healed from whiplash is start stretching it. The first thing you want to do is let that tissue kind of shorten back up and heal. All right. And then maybe in, I would say probably 3 or 4 weeks, maybe gently start to do some stretching exercises. I have a bunch of videos on that. I got one video specifically on car accidents. It didn't do very well, but it's back probably like a month or so ago, as well as some, it's probably in my playlist like neck pain or something like that. So it goes over techniques that you can do at home to help reduce your overall pain from a car accident. Yeah, thanks there, X-ray lady. Yeah, Scully's pretty cool. I'm still working on him, or he's working on me, or maybe a little bit of both. Not sure who's training who, but we'll get him going a little bit better here. Maybe by the summer. We'll see. All right, so no more questions about that. I'm going to go ahead and move on with the neck a little bit more. We have these things. I'm going to bring down Big Bertha here for a second. We have, because you can see, you know what? Actually even have a better view. Let me put Big Bertha back up here for a second. I'm kind of getting ahead of myself. Let's go ahead and let's say we took just one of the bones off. All right, and we kind of blow it up, and this is what you would see. You'd see like one vertebrae segment here. And so we have two vertebrae. You have one on the top, one on the bottom. You have your spinal cord in the back here with the nerves that come off of the spinal cord that make up your arms and legs. But in this case, we're talking about the neck, so it's your arms. And then we have the disc here in the center. That old one neurosurgeon told me years ago, you know, a degenerated disc is kind of like dry seaweed, and a healthy disc is kind of like wet seaweed. That's the kind of the consistency of it. It has synovial fluid that nourishes the actual disc itself. And as we wake up in the morning, it's at its largest or at its apex. And as the day goes on and gravity, it kind of smushes down, and it can cause some pain from that. Oh, all right. I got 8 people. Oh, this beautiful. Thank you. Thank you. All right. So we're going to talk about that neck pain on the side. I'm going to put a little pen. In this case, this is an envelope opener. This little joint on either side, this is what kind of connects the two bones. And as you connect them all together, you have yourself a spine. And so we took one little segment out, and this joint right here is called the Z joint, or facet joint, or zygapophyseal joint. That's a $50 word right there, zygapophyseal. But essentially, it's got a capsule in it. It's got cartilage on either side of this bone because they kind of move on one another. And so they have to glide. And in your neck area, they're not vertically this way. They're kind of obliquely as they glide on one another. So, and as we move down the spine, the angles change in these vertebrae. And so we're kind of moving in this direction in our neck. And so obviously you get a lot more moving up and down and so forth. And so this joint right here, just like everything else within what I'm talking about tonight, is nourished by synovial fluid. And so motion is lotion. And so we want to keep that joint moving. If not, it gets irritated. You know, a lot of rheumatoid arthritis or osteoarthritis that gets in that area, boy, and it can make the joint feel real stiff. We might have to do some mobilizations to that joint. One technique I showed a while back in my playlist in the neck goes over a towel technique to do some mobilizations. That's called Mulligan's mobilizations. And so this guy a long time ago kind of went over different techniques that you can do in your own home. And this is one of those techniques with the towel with the straight edge. So if you wanted to, you can look underneath that playlist. It kind of goes over that. Hello, Miss Journey, Misha Journey. Yep, got Muggs. It's organic. It's listening. If any of you guys want to talk to each other, got aviation in here. All right, got. Do you know why sometimes part of your body is pulsating? It can be my neck, leg. Oh, okay, that's a good question. Hello, Mustang Sally. So just to kind of pull me from this for a second, do you know why sometimes part of your body pulsating? And so if you're talking about what we call a muscular fasciculation, you know, you can, what we call it like an eye twitch or an eye strain, or you might get your thigh or whatever. That's actually excessive neural activity going on at those nerve fibers that's making it twitch without you doing it. And it's usually overstrain of those muscle groups at some throughout the day that caused in the evening or in a resting position, making those muscles twitch. That's in a normal person. Now, someone who's got a neurological problem, you know, Parkinson's, some sort of muscular dystrophy, multiple sclerosis, you know, you can name a million of MD or, you know, cerebral palsy type neurological stuff. You can get all kinds of central nervous system that looks like something simple, but it's not. And so if you're talking about a healthy person, then yes, it's probably just over stress of those muscle fibers causing them to overfire. and they've gotten fatigued out. But if you talk about something neurological, it could be your central nervous system, which is your brain and your spinal cord. That's your central nervous system. And your peripheral nervous system is basically the nerve endings off the arms and legs, without getting too crazy. You have the autonomic, you have the parasympathetic and sympathetic. I mean, you could go crazy into neurology. So some of my good friends in school, they had a hard time in neurology, and I actually did all right. And I didn't do great, but I did all right. My friends back at Mercy College in New York State. I have MS as well. This is very helpful. Oh, okay. So yeah, see, multiple sclerosis. That's essentially where there's plaques or lesions. I always like to say plaques because lesions always sounded like legions or whatever. But basically they affect the myelinization of the nerve, and as that affects that particular area, it demyelinates the nerve because the nerve has a sheath in it, and that sheath really helps keep that pulse going correctly along the nerve fiber. And when it's interrupted, like in multiple sclerosis, these lesions or plaques or whatever, you start having nerve issues. And obviously the nervous system is what keeps us going. Kind of like a battery on the car. If the battery don't work, the car don't go. And so that's kind of like the simplistic version of it, but you kind of get the gist of it for average Joe. Well, thank you, X-Ray Lady. I'm glad you're still here. So I'm hoping that answered your question, Miss Rosita. If it didn't, just kind of give me more of a holler. I'd love to give you guys more information on that. And so let's go back to the actual neck here. So we pulled one vertebrae out, sort of, in the disc with it, and kind of blew it up, and that's what we see here. And so, like I talk about these Z joints, and when they get stiff or rigid, or if you're having, like you did get in a car accident or whiplash, and all those muscles are just kind of pulled and contracted, contracted and been really tight because of pain and spasms, that will affect these joints. Yeah, and so at some point we need to try and get the muscles loosened up so that the joint can get loosened up so you can get your motion back. I did talk last week and also in my video about active and latent trigger points. When you have a whiplash or some sort of trauma to the neck and area, you're going to make those latent trigger points, these kind of areas that are kind of quiet, you're going to make them active, and they're going to get things inflamed. You can literally type in the one muscle group that I'm going to talk about right off the bat here, the sternocleidomastoid. That's basically the muscle that runs the back of your ear. That little bone back there, I don't have it on this. You know what? I have it on, I got it on Scully. Silly me. So if we look at the back side of your ear, this little thing is called the mastoid bone, and that is where the muscle starts, sternocleidomastoid. So that muscle runs down, one solid muscle, and then it kind of splits and turns into two separate endings here, one at the sternum and one at the collarbone. Okay, it's a bifurcating muscle. It's another $50 word for you, for my brother there, Matt, that hasn't been in my live stream or anything like that. So at some point, my brother from another mother better show up. Okay. Shout out to him. Love him a lot. And so that muscle group is huge. All right. When we're having a lot of pain, that's a huge muscle that actually can get really painful and get a lot of tenseness in it. Or what we call in the fancy world, the real world, the science world, is hypertonicity. That's where the muscle there's tone, there's hypotone, which is less tone. There's flaccid where you're stroking, the thing don't move at all. And then there's hypertone, or the thing is always tight. And so that muscle group in the back there can give you ringing in the ear. It can give you definitely pain around the backside. It can give you pain down in your collarbone or clavicle, because that's where it attaches at, as well as the sternal area. And so, as we talked about one week, where your hand comes over your head, that clavicle has to rotate. And so if you're having a lot of neck pain in the front, that also can affect the clavicle or collarbone and give you pain along that area. And that's a very sensitive area. There's some really superficial nerves that kind of go over the top of that collarbone area, and they can make the whole area feel really tender and sore.
Well, thank you, Cub Den. If you guys have any questions, most of my spine is titanium. I have a neck surgery from 2016. It really helped the cervical vertigo, but now it's back in another surgery. Ugh, wish for PT, but not till after the surgery. Well, there, Mustang Sally. Yeah, I mean, now vertigo or spinning symptoms can come from the neck. It can come from your what we call your in the inner ear, without going too crazy in that when we talk about positional vertigo, or BPPV for short. And I've done a bunch of stuff on that courses over the several years since I've moved down to North Carolina. And yeah, I mean, and that's a whole branch unto itself, because if your head is restricted, not only can it come from your neck pain, but it can also come from if your eyes aren't in your neck, in your ear, not coordinating correctly, and you can go ahead, and moving a certain way all the time without the lack of movement like you're supposed to, or what we could say dissociation, some movements from your shoulders and your neck. You can start having some issues with the crystals within your ear and turn a certain way, and can start to make your head spin. And so that could be treated pretty simple with a physical therapist. And so they would do different types of techniques like the Dix Hall Pike and stuff like that. So that's a whole other branch. We could actually talk about that. Could be a whole video on just positional vertigo and vertigo symptoms and stuff like that. Oh, okay. Well, if they told you that's what it is, and it probably that's what it is then. Hi, big man. How you doing? You guys like to go ahead and connect in here. There's no reason why you can't. If you like what you see, go ahead and connect. Anybody that's new to this channel, you can go ahead and click the subscribe button, hit the bell. And after this live stream, I'm definitely gonna go ahead and see all you guys, and become subscribers. I'm very big in watching people's videos. I try and watch at least 40 or 50% of the video. If it's more than probably 15 minutes, I usually try and watch just 50%, unless it's something I really want to look at. So because I don't want to ruin you guys' view times and stuff like that. And that's really the issue here is that 4,000 hours is just a killer for a lot of people. Don't get me wrong, getting 1,000 subscribers is not easy too, but that definitely the watch hours is getting a lot of people, including myself. All right, so any questions? Did I miss anything? Oh, it's definitely my neck. Okay. Hello, sir. Hello to everyone here. Hi. Hi, Ian Garcia. Hi, how you doing? Thank you for coming to my live stream. If you know anybody here, if you don't know anybody here, you can go ahead and talk amongst yourselves and hopefully get connected. I'm not one of these people here that says, oh, don't connect, or whatever. I realize that some of this is information, as well as I realize some people want to come here and hopefully grow their channel also. So I absolutely respect that. Okay, and so we're done with these little things on the side here. A little footnote that no one really talks about. All these weird little bumps that we have that you see on your shoulder blades. Okay, these weird little bumps all over plates within the bones. All right, in the skull and stuff like that. Well, as we grow, our muscles and ligaments and tendons are pulling on that bone as we grow. And so those little, what we call tubercles, or bony, whatever you want to call it, tuberosities and stuff like that, as we grow, they start to get larger because our tendons are always pulling and stressing on that area. And so that's when you start to see, when you pull all the tissue off the bone, and you see the bone, from baby to child to adult to elderly, you really see the changing of the actual spine itself. And I think, if I remember correctly, maybe because someone could tell me, that our spine, our actual bones themselves, regenerate 3 times within a human lifetime. And so that's kind of a cool little tidbit that maybe you didn't know about. I like to throw out some of that stuff too. Yes, I'm a doctor of physical therapy. Yes, I have a doctorate degree. Basically, it's the same as like a pharmacy, what they call PharmD. A pharmacist has their doctorate, or a nurse practitioner, or a physician assistant. Most healthcare professions over the last, let's say, 10 years or so, and then beyond, they've all gone to more of a clinical doctorate degree. It's more schooling. You learn a little bit more of this and that. And so, yes, I guess I could call myself Dr. Kenny. I choose not to because it confuses a lot of people. When you say doctor, the first thing they think of is a medical doctor. So, I mean, you even have nursing that have, I think, a doctorate degree now, which if that wasn't confusing enough. But yeah, that's yeah. I went to school a long time, and did well enough that I got through, and hopefully bestowing some information on you guys to hopefully help you at home, as well as maybe answer some basic questions. Obviously, this is not a substitute for going to see your doctor. If you're having problems, you better go see your doctor. This is more of information that can kind of fill in some of the gaps, because obviously the physicians and everybody else nowadays is seeing people much less and seeing a lot more people. So they're trying to make up their reimbursement in volume versus seeing people one at a time. So hopefully I can give you some information. Oh, that's a good one there, Larry 5200. Oh, would you recommend PT or a chiropractor for a ruptured discs? All right, that's awesome. Well, thank you for that. So let's talk about that for a second. Let's talk about what the heck is a disc and what's it mean to be ruptured. All right, and so the disc itself is gelatinous. It basically keeps the space. It's our spring mechanism as well as the curves within the spine. This nice gentleman doesn't have the curves like you're supposed to, but that's basically it. And it's more of a spring. You have to have that spring, and that actually displaces the forces equal through our spine. So that disc, it can go ahead, it can bulge, all right? It can herniate, it can rupture, all right? And then it can be fragmentation. So which means is that pieces of the disc rip off, and it's just floating within the canal space where my fingers where this little tool is at. It can float within there and start knocking things around and cause scarring and stuff like that. If you have fragmentation, you're going to have surgery. Your body could reabsorb it, but the likelihood is less. When the body reabsorbs something, it's called phagocytosis. There's another $50 word for you. But your question was, should you see a chiropractor or a physical therapist? If you have a ruptured disc, all right, that's telling me that the disc is actually pushed onto the nerve itself, and you're having constant symptoms, whether it's only sensation issues, burning, numbness, tingling, or if you're having the next part, which is that motor part, you're also getting some weakness in that, in whatever area that nerve is actually pinching on. And so if that's the case, you shouldn't see a chiropractor or physical therapist. You probably should go see your medical doctor. They should probably send you for an MRI. If they're really awesome, they'll send you for a contrast MRI so it lights up the area even better, though a regular MRI can see the disc issue. And then they'll go ahead and probably send you to either an orthopedic or a neurosurgeon, depending on what you both talk about. But if we're just dealing with a disc bulge, all right, maybe you could have a slight herniation that's kind of going back and it isn't causing any inflammation anymore. Then I would recommend to see a physical therapist. Obviously, not only because I'm a physical therapist, but anytime you're having disc nerve symptoms, it is inappropriate. It is a contraindication to manipulate the spine. All right. So I'll fight with chiropractors all day long. I'll show you the research that says if you're having disc nerve issues, sensation and motor problems, you should not be manipulating that spine with a grade 5 thrust. You want to talk about that little springy thing with a rubber on the end of it, all right, and they want to call that a mobilization. fine. You can go ahead and play heads or tails. I mean, they're not giving any more force than my fingers are right now. Okay. I'm not sure. I guess technically you're calling it immobilization, but you're not getting any joint. What someone would have, a layman would go see a chiropractor, just, hear the whole popping and cracking. You wouldn't want to see them for that particular problem. Well, okay. Well, if the doctor's recommending a fusion, and depending on, is that an orthopedic? Is that a neurosurgeon? Is that your primary care? All right. Is it when you go to see a primary, is it a physician assistant or nurse practitioner? I mean, kind of define with me who's my doctor. If it's an orthopedic or a neurosurgeon, and that's probably appropriate. They're very smart people. What I would suggest to you, if you're kind of leery about it, I would look them up, see what they rate as with other patients. Most people on the websites nowadays, they all have a rating scale. How good are they? Afterwards. The other thing is maybe you need to get a second opinion. Can't hurt to get a second opinion and see what they say. If it was me and I had the problems, I probably would want a second opinion just to make sure. Take, two heads are better than one, so to speak. That's why I have Scully here. Two heads are better than one. And get an idea, maybe it will at least ease your anxiety or stress or worry about, am I taking a big plunge and getting a fusion or not? All right, bye, Mugs. Bye, everybody. Bye, Mugs and Organic. Thanks for coming by. I see you got a few people that left. But thank you, Mustang Sally. But that's what I would recommend is just some basic advice. And that's really just common sense. I mean, you could talk to your pastor or someone else would probably tell you the same thing. Hey, they're really smart. Let's say you went to an orthopedic. All right. They did a 4-year degree. Then they went to med school 4 more years. All right. And then they went and did their residency for 3 or 4 years. And then they went and did their specialty for another 3 years underneath another surgeon. 3 or 4 years. It's probably 3. I think it's 3 years. Hold me to it. I'm not a surgeon, but if I remember correctly, I think that's what it is. They go a long time. Let's say from high school to when they graduate, they're probably in their early 30s when they finally get out on their own. All right. So they're really smart. Are there good ones and bad ones? Yes, there's good ones and bad ones in anything. And hopefully, if you get that second opinion, it can kind of confirm or deny what that first doctor said to you. All right, so you've seen a neurosurgeon. So yes, they're super smart. I mean, if they're telling you that, hey, you need to have this done, all right, then you probably do. You're talking to a physical therapist. All right, I have 7.5 years of education and 20-some years experience. All right, theirs kind of trumps me a lot. All right, so they know your history. They know you. All right, I can just give you some information that you can go with and hopefully give you some extra positivity that, a lot of times you always hear just the negatives out there. You never hear the 3 million positives of surgery. All you hear is the one person like, oh my God, they paralyzed me. All right, well, they're human too. And maybe the reality is that you had a lot of what we call comorbidities, a lot of, maybe you had bad healing diabetes, blood pressure, God only knows what else going on, and that they were probably took you on and it gave you the best possible result for what they could work with. So you got to give them credit. Well, thank you, Mustang Sally. It sounds like you're in good hands with them. I was going to say good hands with Allstate, but heck, they're not giving me any money either. All right, so let's go ahead. So we talked about whiplash because that nice gentleman before up here wanted to talk about whiplash. Anybody else have any more questions before I move on? So let's go ahead and, all right, no more questions here. All right there, Mustang Sally. Now, you know you can't put all those emojis in there. Those emojis will look as a spam, and then they'll go ahead and they'll take my entire, I don't know how long I've been on, 40 minutes and say I can't use it. They are big bullies, this YouTube, every once in a while when they want to be. All right, so we talked about, let's bring little mini-me back here. And so little mini-me here, we talked about those muscles that run the base of the skull that can give you pain. And we talked about which segments of your spine actually move the most. And so we talked about if you have arthritis within this joint area where it can really start to affect you, and how the one playlist treatment is that Mulligan's mobilizations with the towel roll that, or which gives me with the straight line towel that you can go ahead and look at. That's in my neck playlist. That will actually help with some generalized arthritis of the neck. There's always a TENS unit that I talked about before that can work on the superficial, neck muscles. Oh, that's all right, Mustang Sally. No worries about that. Yeah, and every week YouTube is changing what they want, what they will allow, and what they won't. So, you know, it's like anything else. It's Big Brother. What they allow is what we're allowed to do, obviously. All right, so next thing let's talk about. We're going to talk about good old fusion for a second. So I'm going to bring old Big Bertha here for a second. Let's say here that they fuse. A lot of times they end up fusing 6 and 7 because that's the disc moves the most there. It tends to get ruptured or has damage in that area, so they end up fusing that area. What we need to do at that point is work on your mid-back. And so you're going to take good old towel roll that I talk about all the time, magic towel. Take magic towel and roll it up. I talk about this even in the clinic. Take some tape and roll it up. So you got good old magic towel. Don't use a pillow because the pillow just flattens out. You want something fairly dense. And you're just going to put it right at the mid-back. And you're going to want to cross your arms and just extend. You're not moving your neck. You're just extending your upper back. And that naturally allows your head to fall back in place. And so it will take some of the stress off those muscles because you don't want to always be overstretched and elongated. Being over elongated all the time will also cause pain. Your body doesn't really tell whether something is overstretched and that feels like it needs to be stretched more, which is inappropriate, or something that's really short and needs to be stretched out. And so be mindful of the over forward head posture bit because that will go ahead and give you problems. So you can literally just use a towel and just kind of sit back on this. Do maybe hold for maybe 5-10 seconds and then come back and relax and repeat maybe 10-15 times. And then just sit like this. Realize that you're going to sit like this for maybe 10 minutes or so, and these neck muscles are going to get tired or just start to give you some crampy sensation. You're going to have to take this out and work on that over several weeks until you can get your muscle within the area that we're talking about there enough endurance and strength to be able to tolerate this position for a prolonged period of time. Oh, yeah. Well, Larry 5200, that's true. When you do think of fusion, there is literally you're taking two joints and making them one solid joint at that point. And like I said earlier, if you weren't here yet, if C1 and C2, which they never fuse, they usually fuse C2 and on, okay, because C1 on C2 is kind of like a pivot area. And this is where 50% of your rotation is. It's always a looking down and looking up when they start to fuse C6 and C7 and then on up, where you start to get that restriction. And realize that's a permanent restriction. If you try to start forcing that more, you're going to start to stress that hardware, and that's also going to give you pain as well. So if you do the what I call the towel roll, the thoracic extension, it can at least give you some movement through your mid back and take some of the stress off of the neck fusion area, as well as the tension from the muscles that are over elongated. And so it'll at least help that kind of stuff. The more they fuse, the less movement you'll have. It's literally mobility versus stability. You have to weigh the two. And so there's a reason why we have these little vertebrae, and there's a bunch of them there because we get a lot of motion, but we lose the stability in that area. And so it's a give or take. First thing you want to do is get rid of the neuropathic symptoms if you're having a fusion, or the weakness. All right, the sensation and weakness, whether it's grip or some sort of coordination issue, because the nerves are pinched so much, or you can't raise your arm up over your head because C5, C6, or C7 is pinched really bad and it's not allowing your arm to come up. That's a misdiagnosis. Someone will say, oh, it's a rotator cuff. And they go and they finally come back and they get the MRI on their neck, and it's actually an impingement around that C5, C7 area. And that's what's limiting your shoulder range of motion, not your ball and socket. Oh, I got 4 people left. Maybe more people will come in. I'm fighting with all the other live streamers that are just out there just trying to promote channels. And a lot of times people come in for a few minutes, and if they don't see 15 or 20 people, hopefully the more I do these, but I think I'm fighting with RV. I love RV guy, but I think I'm fighting with some of their time. I don't think I'm fighting with Melda family. I think they're off by now, or should be pretty close to being off. I'm going to try a few more weeks at 6:30 and see what happens. I might have to push this time later. It all depends. I think I might start asking over the weeks to see exactly when's more people on to be able to, or wanting to watch my content. Or like always, they could watch this later. That'd be cool. Well, thank you, Larry. I appreciate you coming too. If you don't have any more questions, I'm going to keep moving on. Wow, Mustang Sally, you are so sweet. I appreciate you. I really do. It's like when you get a real subscriber, it's like a delicate flower, and you just want to nourish it with sunlight and a little bit of pixie dust, because it's very rare to have a true subscriber versus the ones that just want a number, you know. So I'm hoping I'm giving good content, not only educating and giving you guys tidbits that you never hear anywhere else, but also the videos that I also do on the weekends are not only comical, but they also can give you some treatments that you can do at home. That's kind of like my niche, to kind of do things that you can do at home to help improve your overall pain. Because as far as I know, there's no other content creator doing that out there. They're showing some stretching exercises. You might have some guy out there with some cannons, and he's ripped from head to toe, that's showing you some stuff in the gym. But as far as I remember, maybe you guys can give me some hints, I don't see anybody out there that's doing this kind of content with physical therapy kind of treatments that you can do in your own home. I don't think so. Oh, thank you, Mustang Sal. Yeah, it's just my personality. I'm kind of goofy. I try not to be serious too much because there's already too many serious people out there. Okay, so on to more exciting stuff. So there's one technique. I don't have any tape here, but I show it on my neck ones. It's called Kinesiotape. It's an elastic-based tape. I might show it probably next week's live stream. I'll probably get some. But it comes in a roll. You can buy it online for probably 10, 15 bucks at the most. It's the elastic one. Comes in 100 different colors. What you want to do with that Kinesiotape is you want to put the person into an extended position or a looking up position. All right, we'll do a little mini-me here. You want them to kind of look up, and then you want to put that tape with zero stretch, because it does have a stretch. You want to put it zero stretch from basically the base of the skull down through each side of the spine. And so when you start to look forwards in a resting position, it kind of gives you a little hammock or support to those muscles. So if you're having active trigger points or suboccipital headaches or just generalized pain along the neck and the muscles that run the base of the skull, there's a big one here that does a lot called your levator scapula muscle. And I did a whole video on that. I actually have, I think the thumbnail is a green muscle. That's your levator scapula. But that basically, that muscle runs from the top of your shoulder blade here that I'm pointing and attaches to the side of, I think it's 3, 4, and 5 of the transverse processes, if I remember correctly. The transverse process meaning these little bones out on the side. And so if you're having something that's over protracted, over forward head, that muscle group will be over elongated, and that will cause a lot of pain. And so a nice couple of techniques, that one is the taping to support you here, or you can take the tape and come all the way down to the top of your shoulder blade and just kind of come into a shrug pattern first and lay that tape on. And then when you go ahead and relax, there's also a nice little hammock effect going on, and that will go ahead and hopefully reduce some of the active trigger points along the base of your neck in the skull, as well as along the back side of the shoulder blade. That medial or inside border of your shoulder blade has a lot of active trigger points. And when you kind of come out like that and it opens your shoulder blade more, it kind of shows those muscles on the inside, and those also can get really inflamed and irritated too. So the towel roll technique kind of puts those things in a shortened position. The taping techniques can also help with that too. Hi, Rigid. How you doing? Hey, Dave. Oh, that's all right, David. We were just going over some stuff. If you guys see anybody in here that you want to leave maybe some love to them, maybe you guys want to talk back, maybe you could get a subscribe here or there. I think at some point, David, I probably had maybe 8 or 9 in here. You can probably go ahead and look back at the end. There were some new people in here that probably you hadn't seen before. Maybe you can go ahead and talk to them, and maybe they will give you some love back, because I think some of them came in early, and we're hoping that some of there are more creators in here. And I've only done this as I think my 4th live stream. I just haven't done enough of these. I'm hoping to get more people in here. Oh, yes. I experienced neck pain after chest press. Any ideas? Oh, man, David. Okay, so is it a chest press that you did in a sitting position, or were you lying down on a flat bench and did the chest press? So kind of tell me, what position was your body in when you did that? Wait 1 second, Rigid. I'm going to answer your question too. Laying down. Okay, so he did the classic bench press routine. And so what happens there is, if that weight is too heavy, or the technique, let's say you're more of a wider grip and you went to did that press up, if your shoulder blade rotator cuff muscles aren't strong enough, they're going to start to give you a lot of pain. I talked about this right before you came, David. The levator scapula muscle running from the top of your shoulder blade here, all right, or what we call the superior spine in this area, all right. This is the superior angle, excuse me, of the scapula, runs all the way up and attaches. And if you were anyways protracted or rounded out, or if you had a little bit of kink to your neck, any type of rotation at all when you went to do the press up, because it was a little bit harder, that's what you went and inflamed. You went and got that levator scapula, and that will cascade into across the back of the shoulder blade here along the rotator cuff. It will also go cascade along the rhomboids, which are in this area in the inside shoulder blade. The best thing you can do, excuse me, is probably ice it if you did it immediately, and get yourself back in that short position with good old Mr. or Mrs. Towel roll, and keep yourself in that nice shortened position. So that's what you did. You actually caused if you typed in Levator scapula, Levator scapula, Scapulae, scapula or scapulae, depending on verbiage. Or you could look at my playlist under neck. It'll give you all the home treatments to help fix that. All right, let's talk about, would rear delt work make it less likely to happen? If you're talking about your posterior deltoid, all right, or your back deltoid, those deltoid muscles basically just do this motion. Now you could get a little bit forwards to get your front delt, your middle delt, or your back delt, but you have to be mindful to get that backside deltoid. You have to come behind your back and come up, and hopefully rotate your thumb up to take less rotator cuff impingement. So yes, but you have to watch out. If you ain't got a strong scapula, strong shoulder blade, remember, this is your foundation for this whole structure here. If you have a weak shoulder blade or a weak core, and you start having to press up or start doing this stuff, you're going to cause problems because your foundation is weak. Always want to work proximal shoulder muscles first. All right, your shoulder blade, like inside rows. All right, and maybe come out and do another row, and then come up and do another row. You want to hit the upper, middle, and lower trapezius muscle groups. All right, you have an upper, a middle, and a lower trapezium muscle group. So you better make sure you got that shoulder blade strong before you start throwing your arm all over the place or out to the side like that, because weak foundation, you'll start having pain. You'll cause an injury, whether it's a rotator cuff or whether you flare up trigger points or what have you. You can really mess yourself up first. So be mindful of that technique, then worry about the weight afterwards. All right, I got to get on the ridge here for a second. All right, so he's talking about back pain in the morning, and that's when it's the worst. All right, back pain is interesting. So we're talking about the lower spine. All right, so if we bend forwards and bend back, all right, 50% of our motion bending forwards and bending back comes from L5S1, right? Can you see that? Yes, you can see that. Okay, comes from this last segment. Now this segment, God's creation or whatever you want to call it, is a wedge shape. Not very smart. Well, you can say we're on hands and feet, whoever wants, whatever debate you want, but needless to say, it's more of a wedge shape versus the rest of the vertebrae and discs are in a horizontal plane. All right, and so just because the angle of our tailbone or sacrum and our pelvis, it's more like that, and it can take a lot more stress, and it ends up getting degenerated and irritated. Now, it could be coming from a disc, and be just like in the neck, it'd be coming from the facet joint, whether it's this joint in your neck, or in this case, when you talk about the lower back, that's coming from down there. And so I have a ton of videos on lower back, a disc issue versus spinal stenosis versus just weakness, positional issues that's causing the pain. So you can kind of look through that playlist. That can kind of give you some home treatment ideas. Thank you, Mustang Sally. And so let's talk about, you also talked about, you said inversion table or tilt table. Is that all hype? No, it's not all hype. I actually have a video. Oh God, this is probably 2 months ago. It was maybe like 4 weeks after I started doing this, because I've been doing this since I think November, late November, early December is when I started doing this 2019. And I have a video on there about my inversion table or tilt table. And so you can look at that if you want to, but let me give you the skinny of it. Now, they're okay for some instances. If you're having a lot of arthritis, you have to be mindful of how much distraction, all right, or how much pulling that you're doing on that joint. Those joints, as you age, there's a disc in there. the disc, as well as there's cartilage in a capsule in this area, and you're stretching that out. If you put too much stretch on it for a long period of time, and that might be 10, 15 seconds, especially if you're talking about your body weight, all right, you can really cause a lot of pain, cause a lot of inflammation, and really mess yourself up. So I always say the inversion table, start out light. You know, start out with just horizontal. Don't worry about doing any tilting back, and see how you do with 3 or 4 times like that. And then slowly start to tilt yourself back and go from that. Really, maybe 5 to 10 seconds at the most at the tilt, and then come back and do that for maybe 5 minutes and work your way up to 10, 15 minutes, and then kind of progress your angle. Don't go angle first and then time. All right. Go time first and then angle. That way you can see how well you present. But essentially, yes, that's essentially taking some of the stress off the disc and also some of the pressure off the joint. And if you're having stenosis, which essentially is a word is narrowing of a canal. Now, you can have stenosis anywhere, in an artery, in a vein, but in this case, we're talking about where the nerve comes out through the canal. And so if you have a really degenerated disc and that canal is really narrow, all right, then you can go ahead and open that area up, and that will hopefully reduce it. But let's say that you have, let's pull this thing out and really show you. Boom. Let's say you're, see that little thing there? Woo. Let's say that you're having a problem, and you go ahead like a disc, and then you go ahead and do that and pull that and pull that and pull it. You can see how if you're having a disc problem, that can also help a little bit too. But you got to be very careful, because you can really get things inflamed. So be safe, go slow, because it's you don't want to go fast and mess yourself up. Hi, Nicole. Thanks for coming. Yes, if you all want to connect, that's great. I know I have probably 6 or 7 people here at a time. Hopefully in time we'll get some more. So if you had any questions about your neck, or this part of the spine, we can go ahead and talk about that. One thing I hadn't talked about right now that I wrote little notes for myself is any type of neurological problem. Let's say you're having fibromyalgia, or you've had a stroke, or traumatic brain injury, or Parkinson's disease, or multiple sclerosis, or muscular dystrophy, or CP, or any other type of neurological thing going on, hydrocephalus. I mean, there's tons and tons you go on all day. They can also get a lot of neck problems, and that's coming from their nervous system a lot of times, or it could be postural, depending on if they don't have certain movements, or it could be joint problems. It could be orthopedic, or it could be neurological. So some of those treatments that I have in my playlist also can help them too. That's all right, Lionel. Thanks for coming to see me. I think there's some people here in chat that you can go ahead and connect with if you'd like to. Right now I've been talking about the neck, but I had a gentleman earlier want to talk about his, it was Ridge Mallory? Yeah. He wanted to talk about his lower back contraction on an inversion table. That's right, Lionel. Better late than never. You're wonderful. I love talking to you. I love seeing your stuff. I looked. You didn't make any content this last week. I was like, well, I already saw that, so I went and saw an old one. Oh well, you get busy. I understand. I get busy, or maybe you're in pain, or you're freaking out about this coronavirus like everybody else and their brother is. But anyways, so let's go ahead and so those neurological things can also cause a lot of muscle tension and pain too. I always say if it's something that's going on for quite a while, like chronic, anything that's 3 months or longer injury-wise is always considered chronic. That's kind of like the definition of something that's chronic, chronicity. Something that's acute or subacute or chronic. So there's kind of the 3 little categories or phases that we kind of in the healthcare world kind of put people in to kind of see, where we should send their treatment, or where we should kind of what road we should kind of put them down for our treatment regimen. Well, boy, Nicole, I hope they're feeling better. That's terrible to hear that. Oh, hi, Delisha. I didn't even see you there. I'm sorry, Delisha. I didn't even see you earlier. Hopefully you got some people to connect with you. That's kind of cool. The people here, they're going to watch your stuff, so they're not on one of these other channels that has 60, 70 people, and the stream is just going through, and you click on someone and they see you, they click on you, they subscribe to you, and then the next day you look at it, what the heck? I thought and they took their subscription away. You're not going to get that here. You're going to get people that are going to watch your stuff. So that's a plus, at least here anyways. I can vouch for the people here, especially all the ones in gray and blue. Oh, wait, that's everybody. All right, so let's talk about the muscles that seem to bother you the most when it comes to your neck. So the muscles that bother people the most, usually in the neck, are what I talked about earlier a little bit, are the muscles that run the base of the skull and attach to the first vertebrae in the neck. Those are your nodding muscles. You want to ice those. They can give you some headaches. Good old Scully here. The next group of muscles usually line the shoulder blade area that run all the way to the neck. And they can give you a lot of pain. They can give you active trigger points. I do have the Theracane. I think when I hit, we'll see what kind of surprises I can give. I think I'm going to be giving out a TENS unit and probably a Theracane when I hit a certain level. We'll see. That's kind of like my thoughts right now. A Theracane or a tennis ball to kind of work on those trigger points. I got a couple videos on that in my playlist under the neck that goes over the reasons for it and how you should do it and ways to be safe. I also have, we talked about the sternocleidomastoid that runs from the back of the ear and runs down and splits and attaches to the sternum and the collarbone. That can give you a lot of pain in that area. You have the upper trap muscle, your shrugging muscle, that can give you a lot of trigger points. People sometimes are kind of pushing in their neck and like, boy, that's, that feels like it's the trigger points in the this neck muscle here, and not realizing that they've pushed past the upper trap muscle and they're pushing down into this little crevice here. This is your supraspinatus. All right, that's your main rotator cuff muscle. Yeah, that's a $50 word for you, Lionel. That kind of comes through this canal here and attaches on the front side. That's your main external rotator, as well as the initial lift off of your shoulder. And that can get active trigger points in it. It's not actually coming from your upper trap. It's actually coming from your rotator cuff. You've kind of pushed down in real deep, and that's what you've kind of irritated. You can have the muscles that run on the sides, called your scalene muscles, all right? And then they can kind of come on up in. You have one of them that actually attaches to your first rib, and you can have some rib issues. Some chiropractors and some doctors of osteopaths love to manipulate that first rib. It hurts. I don't do it because it's very sensitive, even when you don't have a problem, because of all the little tissue around in that area. You have what's called your brachial plexus. That's the nerves that come out through your neck, bundle of nerves. All right. They come down through your collarbone. They come underneath your collarbone, come out into your chest, and make up all the nerves that run down into your arm and your hand. And so you can have a brachial plexus injury or inflammation. So pushing down into that first rib, if you don't know what you're doing, is not very smart. You could really irritate that area, as well as you have lots of little nerves down in this area. Oh boy, he's got kettles whistling. All right, Lion, I'll see you in a second. Any questions at all before I keep going? Nope. Okay, I don't see any, so I'm going to keep going here. Now, first of all, no question is a dumb question, only the one you never asked. So let's talk about this fascia thing. So see this? Watch this. This is pretty cool. That's extra skin and fascia. That allows this whole thing to move around like it should. And that can get very inflamed with any of the suboccipital muscles, all right, or the muscles along the sternocleidomastoid can come up and give you what we call temporal headaches. You know, people call them tension or stress headaches. And so you want to be mindful of, you know, when it's really irritated in the neck, don't also forget about the scalp. You know, maybe get a little heating pad or whether a hot water bottle, there's no burning yourself, and just kind of get your fingers in there. I'll show you on Scully here. You kind of get in there and just the tips of your fingers and just gently kind of circular motions, clockwise and counterclockwise along the sides of the scalp. That's very, very relaxing. And that's the reason why I love to get my hair washed, because they get nice and deep in there, and it just really starts to get those tissues to relax. And so you can easily do that. I would recommend that you probably do it lying down, just so the other muscles within your neck are also put in a nice relaxed relaxed position. But that's a nice little technique that you can do on yourself. Any info on corona in your area? Hi, Serena Joseph. Go ahead and connect with these people if they like you and you like them. Hopefully, it'll be a good match. And so let me answer the first question here. Does corona? So he's talking about the coronavirus in my area. So it's like everywhere else. I don't think it's in the schools. I mean, I would tell you to look at the World Health Organization, the WHO, and they can give you a lot of information. I'm a big Joe Rogan fan. So if you don't like Joe Rogan, don't hate me. But you know, he's a Joe, I'm a Joe. And he had someone on his podcast that was, I think they're definitely a physician. You can go ahead, and they gave some good information today. I'm not sure why everybody's buying all the toilet paper. This is a upper respiratory issue, not a GI, but I could see if you're cooped up for a few weeks, but I always thought that was a big hoot. But, you know, they're telling you all the silly things that you should be doing, whether it's the coronavirus, the flu virus, the stomach virus, or whatever. You always wash your hands. I think the statistic is people don't realize they touch their face between 2,000 and 3,000 times a day. People buying dust mask for a virus is foolish. Going to Lowe's and buying a dust mask that they use to spray chemicals or whatever, it's not going to work on a virus. I mean, I'm not a physician, but you can ask any physician. There's dust masks for certain things, all right? And this being one, they have the ones with the filters and the cartridge in them. There's a reason why they have cartridges in the dust mask and the facial mask, because the different cartridges separate out different types of chemicals and viruses and bacteria. So if you ain't got the right cartridge in the mask, it don't matter. And they only last long anyways, the filters do. So I saw someone wearing a bra. Oh, good Lord. Yeah, Michigan, great outdoors. Love you. Yeah, that's right. I think I saw the CDC. That's what I'm talking about. Yeah, he had a solid broadcast on that. So, I mean, I'm a physical therapist. I can just tell you what my information is. But I would say World Health Organization, the CDC. I mean, listen to those people. They're smart. They're experts. That's what their profession is. Don't listen to the brother down the street. He's got a belly button. You got a belly button. That's probably the only thing he's got in common. All right. Listen to the experts. Yeah, it's a virus. It's going to spread. Viruses spread. They've been around for billions of years. They mutate. They're like anything else. They just, you know, we do the vaccine every year for the flu. The flu, you know, there's thousands of flu. Hopefully, we pick the best 4 strains out there and we get inoculated for it. A lot of years it was a hit and miss. You got the vaccination. It didn't matter anyways. You got the flu. So yeah, I mean, vaccines are our best treatment. Fight for it. And then obviously wash your hands, use Lysol, you know, clean things that you should clean anyways on a daily basis or a weekly basis. Whether it's a, you know, a pandemic, I think the World Health Organization is putting it right now or not. You know, I mean, that's not rocket science, people. You should be washing your hands. Oh, I got to go back because Joe just had a solid podcast. Okay. I know I missed a question here, a few of them up here. Oh, rheumatoid arthritis, does it skip a generation? I don't know. Rheumatoid arthritis is a systemic disorder. So that means it can affect any joint or any organ in the body. And so that's the difference between osteoarthritis, rheumatoid arthritis. There's psoriatic arthritis. That's another type of arthritis out there. That's that I think that, no, don't hold me to it. I'm probably going to get someone that's going to beat me down for this, but I think that could be a familia or a family kind of hereditary type problem. I'm not sure rheumatoid it is because, but anyways, you could look online and see if it is this type of rheumatoid arthritis. But this whole thing is skipping a generation. I'm not too certain about that. All right, I think I answered everybody's question so far. All right, so we're going to go back to the neck a little bit more if you want to. I've been drinking milk. That's right. Milk does the body good. Unless you're lactose intolerant like me, milk does not do the body good for Joe. Right? Okay, and so the neck itself and the muscles can cause pain and referred pain, and those are called active trigger points. We talked about arthritis can cause pain within the joint space or within the joint itself, or as the disc starts to degenerate and flattens out, you can see that starts stressing the backside of the joint, and that can give you referral pain. You can go ahead and have suboccipital headaches, and that can give you pain. You can have symptoms down your arm from a pinched nerve or just inflammation. So let's talk about that for a second. Inflammation around this area, around the nerve endings, can cause pain or tingling down into your hand. It doesn't actually have to be a structural pinch onto that disc to the nerve. You can just have what are called histamine reactions and get that nerve inflamed and cause symptoms down your arm. That's the reason why sometimes your primary care doctor will give you what we call a steroid pack. It might be 5, 6, or 10-day taper down method of a usually prednisone to try and see if they knock that inflammation out, does your symptoms go away? Because maybe it was just an inflammatory process from maybe the joint got inflamed and caused the nerve to get irritated, or maybe you do have a little disc problem in there. Be mindful of that. Disc itself does not have nerve endings. You can have a disc bulge, okay, and never have an issue because it's not pinching onto the nerve. And so that disc tears and heals. The disc tears and heals. And if it pushes out onto the nerve and then comes right back in, you might get an inflammatory response there and have symptoms. And a lot of times if the medical doctor can't help you, the physical therapist can help you too with that. So a lot of times if this is an inflammatory response, if you're having a disc issue, in what physical therapy should try and do, a lot of times they will do maybe some manual traction. All right. They might do what I like to do, which is called the Robin Mckenzie approach, where we kind of put your neck in certain positions and try and reduce some of that stretch on that joint in the disc, and as well as some of those other techniques that I showed you here today. And that will go ahead and hopefully reduce the symptoms in your arm or in your shoulder. Hi, Lifestyle. Thumbs up on all. Thank you, Lifestyle. Yes, I did not say that. I have 4 thumbs up. Please give me some blues, people. If you come in, give me a thumbs up. That way, hopefully, the YouTube algorithm or whatever will hopefully send this out a little bit more, and maybe I can help some more people. And in reality, this is what it's all about for me, because I'm not getting a dime for this. Is educating more people and hopefully helping people and just giving them some extra information that they can go, ammo wise to help themselves, or when they go and see the doctor or the physical therapist, maybe to give them some more information in regards to their particular problem. Been meaning to ask you opinion on Tommy Copper products. So we're talking about, now try not to do all caps there, Mr. Lionel, because they're going to look at that as spam too. So try and stay away from all caps because they'll look at that as spam. All right, so we're talking about magnets or copper. If it helps you, do it. But I've seen a lot of things out on the market over the years that I just kind of roll my eyes at. One of them that I saw, this was a few years ago, where the person was having sciatica pain, and the product was putting a strap down just below the leg, and they're saying that was going to reduce their sciatica symptoms. Now, I hate to tell you y'all, but that strap ain't doing squat for your sciatica symptoms, because your problem's either at your back, where the nerves are coming out through the spinal area, or it's when it's coming out through the sciatic notch here, that sciatic nerve comes out, and that's where you're having your symptoms. It ain't doing nothing down here. So you see some products like that, or you see the stim machine that you saw on the market that had the abs and it made the abs contract or whatever. That isn't doing anything for someone who has normal stomach tone. Hypotone, yes, but not stomach tone. So when it comes to magnets or copper, there's, I think a lot of it is probably the brace, probably not the actual magnet or copper that's doing a whole hell of a lot. I know there was some placebo out there, and the placebo basically got the same results as the magnet or the copper. So, I mean, the placebo effect is absolutely true. So I say if it helps you, fine. But there's not a lot of concrete research on saying like, yes, you do this will work 99.9% of the time. So you don't get that on those types of products. I do think when they put them into a brace, a sleeve, whether it's your elbow, your knee, or some sort of strap around your back, I think probably more than 50% of your improvement is probably coming from the stability of the brace than it is from the copper or the magnet. So if you guys don't have any more questions on this stream right now, I'm going to probably end it tonight. I want to thank you all for coming out. You can kind of leave comments down below, and I will kind of look at it later if I can. And I'll be bringing new content on Saturday. This week it's going to be on slap tears. That's superior, labral, anterior, posterior tears. And the kind of what's your expectations after a slap tear and what you can do at home and some extra information, some tidbits that maybe you didn't know about. And we're going to go over that. I'm going to make that video this weekend with myself and good old Scully here. But until next time, we want to look up and keep smiling. All right, see you next time, folks. Have a good night.